next?
Well, on Friday we met Jose Gomez, Gina Tunley and Julia Stroud. Following the show, they each went off to have cosmetic surgery, and it is now time to see the results.
So first up is Jose Gomez, and if you are a bit squeamish, then look away now.
On my way to the surgery, not nervous about it at all. I know the doctors are really good.
After a consultation with the nurse, Jose is ready for his procedure. First, one of the surgeons feels for and marks the underlying muscle. These marks help the surgeon know which fatty areas to remove. He marks a V shape pointing towards the groin. This will achieve that characteristic athletic look. Small incisions are made so local anaesthetic can be inserted under the skin. Jose will remain awake for the entire procedure, although he will be slightly sedated. Ultrasound rods are then inserted into the incisions. The ultrasound liquefies the fat. The fat is then removed with suction. The surgeons sculpture the fat underneath the skin so that the shape of the underlying muscle becomes more prominent. In total, around 2.5 kilos of fat is removed from Jose's stomach and chest area. Within minutes of the surgeons completing the procedure, Jose comes round.
How are you? Okay. Brilliant.
It's an instant result. Jose has a six-pack. He might be tired, but he's very happy.
Wow, and starving.
Have some of my toast.
Why did you decide to do it?
Obviously the look, and I guess it's just sort of the impetus to get that kickstart. I do a lot of sport, lead a healthy lifestyle, but I'm just not going to spend 3 or 4 hours a day in the gym to actually get that six-pack.
And now, a couple of days later, how do you feel?
I feel brilliant. I mean, genuinely, I'm not on any painkillers. All I've got is some of the tubes still for the drainage, and that's the only real discomfort. But I've even started eating a bit healthier. It starts to give you that desire to treat yourself a little bit better.
Well, this can sort of change the other way just as quick, can't it? I mean, if you put on sort of more than a stone, then it will go back.
Well, it comes back, but it won't come back in the same places because the fat cells have been removed permanently.
So actually, it is pretty.
It is, and I think the big thing is that it gives you a bigger desire to change the way you're living.
Well, Dr. Mike Comins is the man who did the procedure, so how permanent is this?
Well, it is permanent. I mean, fat cells don't grow after 16, 17, so it's more or less permanent. So I have to get it right. I have to get the fat sculpted properly, otherwise it's going to be permanently there, and if it's not done right, then we are going to have a permanent problem.
Yeah.
So there's a lot of skill, really. I mean, I'm not to get it sort of spot on, a lot of practice. But no, it's there.
And you're not under a general anaesthetic?
No, it's done under local anaesthetic. Some patients like to be sort of sedated, so it's like a sort of twilight sedation. If you get the can just sort of prodding in there, and the movement of the instruments can be a little bit off-putting, but it's done under local. But as you say, if you put on some weight, you can put on about half a stone to a stone without it looking any different. You then, if you carry on putting on weight, it would just look like a rounded six-pack, really. So you need to be a little bit careful. But a stone's a lot of weight to put on.
It is a remarkable difference.
Are you not holding your stomach in there? You're not sucking
No, I was pushing it out.
In?
I was pushing out on both the shots.
It's
really?
quite swollen.
Yeah.
I mean, you can see it doesn't look. It's still quite swollen.
Yes,
on the sides.
So that's only going to get more defined, isn't it, actually?
It's going to, over the next 3 or 4 weeks, up to 6 weeks, it's just going to get better and better.
I am very, very
Is there an age
impressed
limit to the...
Well, there's no age limit, but we are sort of, it's the skin that's important. If there's a lot of loose skin and the skin's not going to sit back on the muscle, it's obviously going to interfere with the overall results,
So a good surgery to have if you lead a pretty active lifestyle to begin with, and it's just that last little bit.
We're not, I'm not saying this is a substitute for sort of, for gym or for exercise and a healthy diet. We're the third rung down, so sort of make sure you get your exercise, you're healthy, the diet.
Of course.
And then if you can't get those end results, I'm really happy to help. But,
and so long as you've got £9,000.
Exactly.
That helps.
Slightly cheaper.
Quite an expensive procedure.
It's anywhere between 4 and 9.
Okay.
But I guess the big thing as well is you really want to be well looked after. And I think it came across in the VT was that going there I was so relaxed, I was so well looked after at the private clinic. Everyone there was fantastic. The doctors, the nurses.
Well, also,
it was actually enjoyable.
For every procedure we're discussing here, aftercare is enormously important.
Absolutely.
Making sure that you're being checked afterwards.